Good day, everyone. We are Group 4, and today we'll be having the post-lab discussion for Monospot test. Now, without further ado, let us begin with the discussion. Now, shown in the slide are the contents or a flow of what we'll be discussing in the following slides. So, first, we'll be having the introduction, which includes the infectious mononucleosis and the heterophile antibodies and heterophile antigens. Next, we'll be having the Paul Bonnell test, followed by the Davidson differential test. Then the monospot test, principle of the monospot test, and the procedure, which includes the materials, reagents, or equipment, the specimen considerations, the qualitative technique, and the semi-quantitative technique, and lastly, the interpretation of the results.
Infectious mononucleosis, commonly known as mono, is a viral infection caused by the Epstein-Barr virus or EBV, which belongs to the herpes virus family. This condition is prevalent worldwide and is often characterized by symptoms such as extreme fatigue, sore throat, swollen lymph nodes, and fever. Infectious mononucleosis is most commonly diagnosed in adolescents and young adults, although it can affect individuals of any age. Infectious mononucleosis is also known as the kissing disease, since it is transmitted through intimate contact, specifically kissing. It could be an acute, benign, and lymphoproliferative condition. In diagnosing infectious mononucleosis, both serological and hematological methods are commonly employed. Hematological is to detect lymphocytosis with prominent atypical lymphocytes, and serological is to detect positive heterophile and Epstein-Barr virus antibodies. In the laboratory, it is difficult to make a diagnosis with just the classic signs and symptoms, which are the manifestation triad: the fever, pharyngitis, and cervical lymphadenopathy, which lasts for 1 to 4 weeks. Therefore, serological antibody testing is used to establish a standard diagnosis. Infectious mononucleosis is characterized by the presence of two types of antibodies: the Epstein-Barr virus antibodies, which are specific, and heterophile antibodies, which are non-specific. Heterophile antibodies are comprised of a wide range of relatively weak antibodies that are induced by heterophile antigens. They are stimulated by one antigen and react with an unrelated surface antigen present on cells from various mammalian species. Heterophile antibodies generally belong to the IgM isotype and are reactive towards red blood cells from horses, oxen, goats, and sheep. These antibodies adhere to the surface of beef red blood cells and are not absorbed by guinea pig kidney cells. Moreover, heterophile antibodies does not react with Epstein-Barr virus specific antigens, and a titer of 1 is to 56 holds significance. The heterophile antigen, Forceman antigen, a glycolipid protein, is a prime illustration of a heterophile antigen. This antigen is located on the red blood cell surface of several species, including guinea pigs, dogs, cats, mice, fowl, and horses. Antibodies that are produced against Forceman antigens possesses the capability to agglutinate sheep red blood cells. These antibodies are present in both normal serum and serum sickness.
Good day, everyone. So, I will be giving a brief discussion on heterophile antibodies and heterophile antigens. So, to begin with, uh, they relate with our laboratory class as heterophile antibodies and heterophile antigens represent a unique area of immunology and diagnostics. So, they play a crucial role in the accuracy and reliability of some laboratory test results. So, heterophile antibodies are a subset of antibodies that exhibit a unique characteristic. which is that they can cross-react with antigens from different species. In most cases, these antibodies are of human origin and can mistakenly bind to antigens derived from animals. This phenomenon is known as heterophilic interference. This can lead to false positive or false negative results in various immunoassays. So one well-known instances of heterophilic interference occurs in infectious mononucleosis testing. The test relies on detecting antibodies against the Epstein-Barr virus, but heterophile antibodies present in the patient's serum may cross-react with the antigens of the virus and some species in the assay. This can lead to inaccurate results. Conversely, heterophile antigens are substances from one species that can stimulate the production of antibodies in another species. These antigen can trigger an immune response leading to the formation of heterophile antibodies. The relationship between heterophile antibodies and heterophile antigens becomes particularly important in the diagnostic setting.
Good day everyone, I am Maybelline Jolloran from Group 4. So there are 5 types of serological tests and this includes Paul Bunnell test. So Paul and Bunnell first associated infectious mononucleosis with sheep cell agglutination and developed a test for infectious mononucleosis heterophile. So the Paul and Bunnell test is a hemagglutination test designed to detect the heterophile antibodies in a patient's serum when mixed with antigen-bearing sheep RBC. So this means that the dilution of inactivated patient serum are mixed with sheep RBC. So it is inactivated, centrifuged, and macroscopically examined for agglutination test. So again, the test is done with inactivated serum heated at 56 degrees Celsius. So that would be all. Thank you. So moving on to the next report.
So for our next test is the Davidson test. This is a differential absorption test, also known as the Paul Bonnell-Davidson differential test. It is a laboratory test used to differentiate between two types of heterophile antibodies, which are the Forceman antibodies and the Epstein-Barr virus associated antibodies. So, heterophile antibodies are antibodies that can react with antigen from a variety of species, including humans, horses, sheep, and oxen. The differential absorption test or this Davidson test is based on the principle that Forceman antibodies will be absorbed by guinea pig or kidney cells, while the Epstein-Barr virus associated antibodies will be absorbed by beef erythrocyte antigen. This allows the test to determine which type of heterophile antibody is present in a patient's serum, which can help to diagnose infection mononucleosis. So how is the differential absorption test performed? So this is performed on a blood sample. The blood sample is divided into two aliquots and each aliquot is incubated with a different antigen. GPKC or the guinea pig guinea cell for one aliquot and blood erythrocyte antigen for the other aliquot. After incubation, the aliquots are centrifuged and the supernatants are tested for agglutination with sheep red blood cells. If the supernatant from the Guinea pig guinea cells incubated aliquot agglutinates the sheep red blood cells, it only indicates that Forceman antibodies were not absorbed by Guinea pig and therefore present in the serum. This suggests that the patient does not have infectious mononucleosis. If the supernatant from the beef erythrocyte antigen incubated aliquots agglutinates the sheep red blood cell, it indicates that Epstein-Barr virus associated antibodies were not absorbed by the
beef erythrocyte antigen and therefore present in the serum. And this suggests that the patient have infectious mononucleosis. So, when is the differential absorption test used? It is typically used when a patient has a positive heterophile antibodies test results, such as the Paul-Banel test, but infectious mononucleosis is not suspected. The differential absorption test can help to determine whether the positive heterophile antibody test result is due to Forceman antibodies. So, what are the limitations of these tests? It could cause false positive if the test can be or it can be positive in people who do not have infectious mononucleosis, especially if they have recently received certain medication or have recent vaccinations. The test can also give a false negative in some people with infectious mononucleosis, especially if they are tested early in the course of X. So, what are the alternative differential absorption um, tests? So it includes Epstein-Barr virus serological test and EBV polymerase chain reaction test. So this is the table that summarizes of what I've discussed just a while ago. So again, for the force man, if it is usually absorbed by our guinea pig kidney cells, and it was not absorbed by our beef erythrocyte antigen. So since it is not absorbed, it will agglutinate, and since the forceman is being absorbed by the kidney cell, so it will agglutinate. While the serum sickness, it is both absorbed by our guinea pig kidney cell and beef erythrocyte antigen, while infectious mononucleosis is not absorbed by the guinea pig kidney cells, and it is absorbed by the beef erythrocyte antigen. So, since it is not absorbed by the kidney cell, it will agglutinate, and since it is absorbed by the beef erythrocyte antigen, it will not agglutinate.
The Monospot test, also known as the heterophile antibody test, is a fast diagnostic test used to diagnose infectious mononucleosis, a viral infection caused by the Epstein-Barr virus. In this test, patient serum is combined with sheep or horse red blood cells, and if an individual has infectious mononucleosis, antibodies produced in response to the Epstein-Barr virus and will cause agglutination or clumping of these cells. This visible clumping is a positive result indicating the presence of antibodies associated with the infection. The Monospot test is well known for its rapid results and simplicity in use, making it a useful instrument for healthcare practitioners to utilize when diagnosing infectious mononucleosis in patients with symptoms, such as fever, sore throat, and swollen lymph nodes. However, in the early stages of infection, it may produce false negative results. Therefore, clinical correlation is required for proper diagnosis.
The monospot test is based on the principle of agglutination, a process similar to the established Paul-Banel tests. In these tests, equine red blood cells serves as the primary material, and it employs latex agglutination to detect specific heterophile antibodies produced by the human immune system in response to Epstein-Barr virus or EBV infection. The monospot latex reagent consists of polystyrene particles of uniform size coated with purified Paul-Banel antigen from bovine red cell membranes. The high degree of purity in the antigen ensures that the monospot latex selectively reacts with heterophile antibodies associated with infectious mononucleosis. The latex particles enable easy visual monitoring of the antibody reaction. In the presence of infectious mononucleosis,
heterophile antibodies in serum or plasma, the uniform appearance of the latex suspension undergoes a noticeable change, exhibiting a clear agglutination. This transformation serves as an indication of the presence of heterophile antibodies and consequently an EBV infection.
Now, let us proceed with the procedure. Beginning first with the reagents, materials, and equipment, as well as the specimen consideration. So, next slide. We have here the reagents and the specimen consideration. So, first, for the reagents, we have the monospot latex reagent, which is a suspension of latex polystyrene particles coated with polybonyl antigen in a buffer. Then we have the positive control, which is a reactive diluted human serum, and the negative control, which is a non-reactive diluted human serum. Now, for the specimen consideration, we have fresh serum. This is a must. It must be clear and free of bacterial contamination. Next, for delay of testing, which is not longer than 48 hours, it should be stored in the 2 to 8 degrees Celsius. Now, for longer periods, like greater than 48 hours, it must be frozen at negative 20 degrees Celsius or below. And also, take note that it is important to avoid grossly hemolyzed serum. Now, next, let us move on with the qualitative technique. Now, flashed in the screen is the procedures of the qualitative technique. So, step one, allow the latex reagent and controls to reach room temperatures around 20 to 30 degrees Celsius. Next, gently shake the latex reagent vial to disperse and suspend the latex particles in the buffer solution. And please be mindful that vigorous shaking should be avoided. Next, place a 50 UL of the sample on the section of the slide. Then add a drop of latex reagent next to the drop of sample, and then mix both drops with a stirrer covering the whole surface of the slide section. Next, gently rotate the slide for 3 minutes manually or on a rotary shaker set at 60 to 100 RPM. And for the last step, look for the presence or the absence of the agglutination after the aforementioned period of time, which is the 3 minutes. In cases that in the qualitative technique, uh, there you have observed a presence of the agglutination, which means that the patient tested positive in that technique, will be proceeding with the semi-quantitative technique. Now, shown in the screen is the procedure of the semi-quantitative technique. So first, we will be placing 50 UL of the normal saline on the slide sections 2 through 6. Then, you will be using an automatic pipette and then place 50 UL of the sample on section 1 and 2 of the slides. Step 3, using the same pipette, take in and release the sample and the normal saline in section 2 several times until they are well mixed. Now, after that, you will be taking 50 UL of that mixture which you made in section 2, and you will be transferring it to section 3. Then you will be repeating the aforementioned operations to obtain a thorough mixing of reagents, transferring 50 UL from section 4 and so on in succession through section 6, and thereafter discarding 50 UL. So note the dilution will be 1 is to 2, 1 is to 4, 1 is to 8, 1 is to 16, and 1 is to 32. Now, step 6, you will be following the steps that were done in the qualitative technique. So, gently shaking the latex reagent vial to disperse and suspend the latex particles. And then always take note that vigorous shaking should be avoided. Next, you will be placing a drop of the reagent on section 1 to 6 of the slides containing a different sample dilution, and you'll be mixing both drops with a stirrer. And then gently rotate the slide for 3 minutes manually or on the rotary shaker. And lastly, again, you'll be looking for the presence or absence of agglutination after the aforementioned period of time. Now let us proceed with the interpretation of results. Now, beginning first with a qualitative technique interpretation of results. So, a positive test would show agglutination and then uniformly distributed dark clumps throughout the test circle against a blue-green background. And then for the weak positive, you'll be observing slight agglutination seen against a blue-green background. And for a negative test, of course, you will be observing no agglutination and then fine granularity against a brown tan background may be observed. And then peripheral color should be interpreted as negative, that is a faint blue-green color halo on the periphery of the test circle. Now, for the semi-quantitative technique interpretation of results, the appropriate titer will correspond to the highest dilution that still presents a clearly visible agglutination. Now, for the last activity that we have performed, pertaining to the monospot test activity in the previous week. Both of our group mates who were subjected for these tests, both of them tested negative in the qualitative technique, hence you're not able to proceed with the semi-quantitative technique. Now that's a wrap. So thank you so much for listening and may God bless us all. Thank you.